Good evening.
Good evening.
My name is Deborah Carey. I'm the Deputy Chief Executive Officer of Operations for Cook County Health, and that is the Cook County Health System that actually, many of you know, we have our main site is Georgia Hospital in downtown Chicago, but we provide health services across Cook County. And the Blue Island now will be one of those locations, and we have about 13 locations from in Arlington Heights, which we just opened a brand new center in Arlington Heights earlier this year in January, and we also have Cottage Grove, which is in Fort Heights. So I'm just going to take 2 seconds to tell you who's here from Cook County Health, and then I'm going to turn it over to Ileana Moore, who's going to make the presentation. As I said, I'm Deputy CEO. Ileana Moore, who's our Chief Operating Officer for all of the ambulatory sites outside of that, beyond the hospitals, and that includes Blue Island. She's going to talk to you a little bit more about what we intend to have in the Blue Island location. And we also are joined by Dr. Amaka Ezeki, who's the current medical director at our Oak Forest Medical Campus, which is actually the center that will be moving to Blue Island. And we're joined by, we also have Letty Close, as our government affairs person as well. I think some of you saw when you walked in the door, our Director of Community Affairs. Oh, there he is, Marcelino's back there. And so we have one of our community specialists, which is and our commissioner, one of our county commissioners, Donna Miller, just walked in. So thank you for coming. And of course our partner, Eric Morrison from Three Corners, who helped us find the location and helping us build what we hope to be a very, very nice center. And again, our intent is really not to come in with a center. Our intent is to come in to be partners and part of your community. So we want to know how we can best do that. So we're going to be talking about, we're going to ask questions, but we're here to also find out some things as well. So with that, I think I got everyone. I think I'm going to turn it over to Ileana Moore, who's going to give a very brief presentation, and then I believe we're just going to open it up to questions. So thank you so much, and thank you for allowing us to be part of the community, and thank you for coming tonight. Ileana.
Great. Good evening. As Deborah said, I'm Ileana Mora. I'm the Chief Operating Officer for ambulatory, so as Deborah said, all of the health facilities outside of our two main hospitals. It's a pleasure to be here tonight. I thank the Alderman for the invitation and the City of Blue Island. I will walk you through a little bit about the project, share some fun photos with you so you can see what's going on the inside of that building as you drive by, and we'll be here to answer questions as well. So, just to give you a little bit of background, we talked a little bit about this, and it's hard to see with the lighting in here, but this gives you a map of all of the facilities that we have across Cook County. As you all know, we have our main Stroger Hospital, we have Provident Hospital, and as Deborah said, we have health centers as far north as Arlington Heights, and as far south as Fort Heights as well. And in total, we have about 16 ambulatory health centers outside of the two main hospitals across Cook County. In terms of our new facility here in Blue Island, our plan is to move our services that are currently housed at Oak Forest, at the old Oak Forest Hospital campus, move those services to Blue Island, and then continue to expand at the Blue Island location. We went through a variety of criteria to determine the location of this new facility and where was the best place and best location for the Oak Forest Health Center. First, we looked at where our patients were coming from, and it was key and very important for us to move closer to where our patient population was. We also looked at lots and lots of buildings. Deborah did that with the team. Lots and lots of buildings because we wanted to ensure that the building was large enough and sturdy enough to be able to house the whole host of primary care, specialty care, and ancillary services that we offer at Oak Forest, and really see it as a regional hub. In addition to that, we looked at where the need was. So looked at the data in terms of where are medically underserved areas, where are there fewer primary care physicians than the surrounding regions. That was another criteria that we looked at, and as well as identifying a place that would have good access to public transportation. So that gives you just a brief overview of some of the things we thought about when we were searching for a location. So what has the last, I guess, 15, 18 months look like. We started this search process well before March of 2018. However, the location was identified back in March of last year. And then after that, meetings happened with the City Council of Blue Island, introducing the project. From there were meetings with the developer that is developing that location on Western Avenue. And then shortly thereafter, construction did start in December of last year. We're currently in the midst of construction, and we expect it to be completed later this calendar year. To give you a bit of information in terms of the type of services that we hope to provide, or we plan to provide and will provide, many of which are currently provided at Oak Forest now. Hopefully you can see some of that. It does include primary care, as we shared. We will be, right now at Oak Forest, it's primarily adult primary care. When we move here to Blue Island, we'll be expanding that to pediatrics and obstetrics as well. We will also be expanding when we come here and provide dental services that we don't currently provide there. And then the whole host of other specialties that will be provided out of the Blue Island facility, everything from cardiology, GI, endocrinology, gynecology, and also the whole host of ancillary services like physical therapy. We'll be doing sleep assessments, speech therapy, stress tests, echoes, x-rays, mammography. So there is a whole host of extensive and expansive services that we'll be able to bring to the Blue Island and the greater community. So what will the building hold in terms of numbers? The building is, you were absolutely right, Alderman, and it's a big building. It's a really, really, really big building. It's 50,000 square feet. So to really redevelop it, it was great for us because we had a lot of things we wanted to put in there. And it's 5 floors, that's including the basement, of which we're building out all of those floors and the basement as well. It comes up to about 50 exam rooms and 3 procedure rooms as well, for any procedures that we may need. 6 dental operatories. We'll have CT scan area, x-ray, mammography. On the top floor, we'll have a physical therapy training room and a community room as well. As Deborah said, we really see this as a resource to the community, a place that we want to be open, connecting, a resource, a place where others can use the space as we've designed our other facilities in Arlington Heights. So what does, sorry, we couldn't quite, the photos aren't quite coming up with the lighting. But this gives you a sense of how the build-out is coming out. You can't quite see it here, so I apologize about that. Maybe we can, maybe we can see if we can turn off a couple lights so you can see it.
Right, and it is constructed, it's still under construction.
It's all still under construction, but these are construction in process photos. So some of the many of the floors have started to get built out in terms of the drywall. The middle photo is obviously a not equipped yet exam room. And on the right side, those are what the radiology rooms will look like. You know, the patient checks in, the tech's behind that suite, and then of course the equipment behind there. So that's just a sneak peek as it's all still under construction. This gives you a sense on the left-hand side, that's the large physical therapy space that will be used. That'll have room for patients to, use everything from the enough space for the equipment for physical therapy as well. And then the right-hand side, that's more of a completed patient stairwell area, as you can see, and then the middle section is a part of a lab. So it's harder to see, so I apologize about that. And then it's all new infrastructure in the building. I mean, it was pretty much a complete gut rehab. There is very little left other than the outside exterior structure. So all new water heaters, an entire new IT system and wiring, everything is absolutely brand new.
Elevator.
Yes, we have 2 new elevators in there. The building came with 1. We thought we were going to save it. Then we figured it was going to be too slow, and so we took those out and are putting in 2 brand new elevators as well. In terms of how our hours of operation, Monday through Thursday we would be open from 7 to 7, and on Fridays and Saturdays we'd be open from 8 to 4. This is just a broad view of what we're planning, the services that we hope to bring to Blue Island and to the region, and just to give you a general overview of the new Blue Island Health Center that we hope opens at the close or near to the end of the year. So now we'll open it up.
Good. Well,
for
I know that there
questions,
was
or
certainly
will
been some interest expressed in what's going on, and if anyone here has questions you'd like to ask, now's the time. Go ahead.
All those exam rooms, all these doctors, where's everybody gonna park?
There you go. That is the question.
Well, I live right around the corner, so I don't have a garage, I don't have a driveway. That's my main concern.
Okay.
Well, one of the things that we do when we open new centers, we are looking at the traffic that's going to come to our center, not only the people who work there, but also the patients. And also, and one of the reasons you see though that kind of 12-hour span there is because what we're trying to do is really sort of spread it out so that we don't have everybody right in the middle there all at once. So we are trying, we do look at that. We are looking at options for our staff parking, which we have at different locations. We actually have arrangements where we identify parking that's not necessarily right at the building. So we would try to do the same thing, and we're beginning those discussions. We're just starting that, but we understand that we heard that loud and clear, that came to us directly, that's a concern, and we are going to make certain that that is our goal is that we will have parking that will not impact the neighborhoods. So that, we've done this in other areas, and we're going to use that same process.
So we had all that, you had all that at Oak Forest, and now what was so wrong with, when they had all that there?
Well, we had,
move it.
right, what we had at Oak Forest was a lot more than just the health center. We actually, I forget the total number of buildings that's on that campus. We were in one building, basically, and it was not a building that was designed for examiners and outpatient. We took one of the facilities that had been, basically it was a skilled nursing building, but it was inpatient. And so even though it looks like we had a lot of space in that building, it would have taken a lot of money, a lot more money even than what we're spending in Blue Island to convert it into a modern ambulatory site, because it was actually inpatient space. We were just letting the doctors use an inpatient room, and because of privacy issues, you could only get one patient in at a time, so what looked like a lot of space turned out to be like a maximum of about 10 exam rooms. So it wasn't working for us, and when we looked at just the total cost of actually bringing it up to what we need to do today in today's environment with all the technology we use, it was just cost prohibitive. It also is very, very, very expensive to continue to keep those buildings on the Oak Forest campus. When you're only using one, or we had some other administrative offices that we are also moving away from Oak Forest. They're going to other locations in the South End area. So we were really using a very small footprint, but the buildings are 100% connected. So we have to pay the utilities as if the entire campus is still open.
So, go ahead.
You're saying you're trying to arrange parking. How many employees do you expect to have in the building at any given time? And how will they get there? Will they take public transportation?
We have incentives. We are going to encourage them to do that. Our patients, by the way, I think you sometimes, actually we saw one of our vehicles while we were coming in the door. If you've seen the Cook County Health vehicles that are riding around different areas, we actually transport a lot of our patients and use them.
Okay, so they won't be parking.
Right. So the number for the health center, the employee number, it's about 100. Again, keep in mind that's 100 employees Monday through Thursday and also Friday and Saturday. So
Okay.
they're not all there at the same time. We do stagger them coming in.
Yeah,
Okay, we actually,
What is your projection of how many parking spaces do you need at any given
That's what
time?
we're working on right now. To see-
So you don't have a projection?
Right. We basically have data that we are having some folks go through to make some, we get to come up with what the actual number.
You don't have a number right
No,
now?
I don't have it tonight. Yeah, I
Okay,
don't.
thank you. And also, the patients, while I agree that Western Avenue and Blue Island has good public transportation to it, and patients can take public transportation virtually to the front door,
Right.
do you have any concept of how many patients will use public transportation versus how many patients will use your provided transportation versus how many patients will use their own transportation and need parking?
So what, I don't have the numbers to give you for each of those categories this evening, but yes, we are going to look at our historical data, which we do have. We think we have a pretty good sense of how many patients are coming by. We definitely know who we are transporting. We absolutely have that. We know today, to be honest, a lot of the patients do drive to Oak Forest. It's the only way you can get there.
Well, that's true.
Yeah, there's a couple buses that come throughout the day, but that's basically.
Yeah, and
You
to
pretty much have
get
to drive.
into the facility and Oak Forest, you gotta get off at 159th and Cicero and walk a half a mile.
Right, exactly. And so we know that that has been, we've been told, that is not very convenient for our patients
Yeah,
at all.
and that I can buy, that I can buy.
I think I saw a hand back.
I was just gonna make a comment on the parking, Ken. And I know we're not supposed to talk about Metro South. However, depending upon what direction that goes, maybe the parking spaces in the garage at Metro South could be used for staff. Just a thought.
Yeah, again, right now, we're considering all the options that will work. It will work for us, and also will work for the community around our health center.
So I have a couple of questions, I'm sorry. One, will you continue the TB testing that is currently offered in Oak Forest? That will continue in Blue Island?
Yeah, yes, because I think we actually have we created space for that, yes.
Okay. And then you said you have 100 employees at any given time. Are any of those jobs still available for posting for people in the community that might possibly be losing their job at Metro South?
That, right now, of course, we have that staff that's working in Oak Forest. We have frequently, it's constant turnover, just natural turnover. And we're adding, as Laura actually said, we're adding pediatrics that we don't have right now, and we're also adding dental, and we're adding OB and a couple of other services. Will have some the ability to expand as we hire the doctors.
Okay.
So there will be other opportunities.
Okay, and then you'll do sleep assessments. Does that mean you'll also have CPAP devices available to patients in office if they do need that, or would they have to go somewhere else for that?
Right, we are not, right now, we're not a durable, what's called durable medical equipment provider. So we have arrangements with other vendors that we refer patients, to give them choice. We refer them to, after the doctor makes the assessment, does the order for it, then we give them options. And again, some of that, it definitely depends on the insurance plans that you have.
Yes. Thank you.
Just while we're having this discussion about parking earlier, and it is a primary concern, I know, from some of the residents that I've been hearing from. I did have a letter that his name is Ansel Johnson, who operates the eye care center across from the facility. He has been and made a presentation at the Zoning Board of Appeals, I think, and he gave me a letter that he would like read into the record. It's a little lengthy, but he asked to do so. He could not be here tonight. And he does have some concerns, so if you'll bear with me, I will do that. And I'll try to maybe summarize a little bit if I can. I will say he has had a business here in Blue Island for I think something like 23 years. A very good business, very successful. And his concern, of course, is about parking because they do use that lot that will no longer be available to some extent, and then he's concerned about street parking as well. So he did give a little information about his background. He's kind of a local guy. He grew up in Robbins, Illinois, attended Eisenhower High School, and played basketball for 4 years. Graduated top 5% of his class, and then went to Illinois Wesleyan, and was blessed to come back to my practice, Vision Salon Eye Care Associates in Blue Island in 1990. Since then, I've been nationally recognized for the level of eye care that we have brought to the Blue Island and Robbins community. I have been twice honored as being one of America's top 101 African American doctors. I have also lectured to doctors locally in other areas of the country. My office has brought innovation and cutting-edge eye care to the Blue Island community for the past 29 years. We are the first dedicated eye care facility in the state of Illinois to have an American Association of Diabetics Education certified education program. We are looking to grow that program in a badly needed area of diabetes education in this area. As we get the word out, area physicians will be referring their patients to our office in greater numbers. We are also service patients with eye emergencies. With the loss of public city parking, it is more difficult for patients to be seen in my office. In 2018, we serviced 1,200 Blue Island residents alone. We draw patients from as far away as Arizona, Indiana, Everson, Sauk Village. Including other communities, we serviced over 4,300 patients in 2018. On average, we manage patient eye health and wellness, optical emergency, and other miscellaneous visits. Many of these patients are senior citizens who do not hesitate to let one of us know if they are being inconvenienced. Patients may make at least 2 or 3 visits a year and office for professional services. Many more often for medically related visits like surgical post-operative care. These numbers result in an average of 30 to 45 patient visits to our office each day. The loss of city parking across the street from my office will have a devastating effect on my patients' access to eye care in my office. We have already heard the complaints when the city lot is full of the vehicles of construction workers and there are no available spaces. This has caused patients to be late and even reschedule appointments because of difficulties in parking, which in the past has not been an issue. I am especially concerned about my senior patients who may be independent but have ambulatory difficulty walking with canes, or etc. Transportation services will now more often have to park partially block traffic or park down the street to unload patients. Many people will be forced to park on the neighboring residential side streets. Since the decision to lease the city parking lot to Cook County was made, no city official has been to my office to inquire about how my patients and the community will be impacted by losing access to the Blue Island City parking lot just across the street. Since I voiced my concerns at the Zoning Board of Appeals meeting, I would invite my city officials to my office to see for themselves how this can affect healthcare delivery in Blue Island. This may pale in comparison to the possible loss of Metro South Hospital, but will nevertheless contribute negatively to accessing a long-standing healthcare facility in Blue Island. It is my sincere hope that some accommodation can be made for parking access for not only my staff, but for patients. Since the deal has been struck, I would like to offer several options. 1, request Cook County allow 5 to 10 parking spots in their lot for local businesses with a 2 or 3 hour parking limit. 2, request Cook County to open the parking lot to the public after 4:30 p.m. when expected traffic should be less. This may relieve some residential parking after 5 p.m. when residents return home. 3, request Cook County to open the parking lot to the public on Saturdays and Sundays all day. These are only limited solutions, but hopefully could help in a small way. Parking during business hours will still be greatly affected. I want to thank Eric Brosen of Three Corners Development for stopping by my office to speak with me to discuss and offer my assistance if he could. So there are, certainly are legitimate concerns. As Alderman of the 4th Ward, we definitely are concerned about this, and we will want to work with you in any way we can. There certainly are options that we're going to have to look at, as was mentioned, maybe hospital parking lots. There's even that auto repair place that's kind of across the street that's been empty for a while, and I don't know what the plans are there, but it's a nice piece of land right across the street. So it will be really important to our community. As much as we welcome you and we are looking forward to having your services, so that we really work on it. I'm available to talk about that at any time.
Thank you, and definitely we hear the Dr. Silver's concern in terms of his patient population. We will talk with him. One of the things with Cook County Health, because of the role that we play in Cook County, yes, we do want to get patients who we take care of, but what we recognize is that we can't do all of this for all of the citizens of Cook County. So we work with other healthcare providers, and someone is getting the right care, and he's doing some wonderful things. We throughout Cook County, we have issues around diabetes, and also eye care is very, very important to the diabetic population. So we want to encourage that to continue. So we would definitely reach out, and I do thank him for also providing some options for us to consider. I think that's really those. I didn't hear anything that's a showstopper.
Okay, great.
So
good.
that was good. Sir.
Why didn't Cook County look into taking over Metro South?
Again, we are basically, we're not here to talk about that and so forth. We basically have our system. We're looking at ambulatory providing primary care services in the community. What we're trying to do is make certain that patients actually have services. Hopefully, frankly, they won't have to need so much hospital services down the road. We know that that's not ever going to go away completely, but we have our sort of plans and our strategies about what we think is the best way to provide care, especially to certain populations that are a little bit high risk in some medically underserved areas.
But I mean, you had all the rooms, you had all the machinery, you didn't have to build anything, you could have just moved to Metro.
We also,
You have
you
parking?
could also see a little bit of that was at Oak Forest too, right? And that's what we basically found that again, it actually, we know what we need for, in terms of these, looking at the information we get from our patients and care. And so basically, our plan is around, community health centers, and we think this is the right and the best solution for what we can do as a county and so forth. And we also have to look at the resources that we have, and they're not unlimited.
I would also say that the, somewhat surprise announcement of the closing the hospital came after their deal was
Absolutely.
done.
It's
No,
not
there's no
surprise,
surprise.
Bill.
Well,
And not that it would have changed.
no, I understand. I'm not shocked.
About Metro. There was talk back in 17 about Metro.
Why would you spend millions of dollars to redevelop a building without a completed parking plan in place for 150, 200 people that you're talking about almost daily? It's like there's a lot of parking spaces that really aren't there. But why would you spend millions of dollars developing this facility with inadequate parking? Without a plan, you apparently don't really have a plan, you said, even now.
We believe that, again, we did consider parking. And we know that looking around and so forth, again, we're going off of what we've done in other places where we have been able to make accommodations, we have been able to address it.
Yeah, I mean, the 100 people, we do not have 100 employees there daily. As you all know from your own specialist, the cardiologist is not there every single day. The GI doctor is never there every single day. There's probably a core group of primary care providers that are there every day, and that's probably closer to 25.
25 people in the
But-
whole building.
That are absolutely there, absolutely every day. But there's a whole host of other people that come, but they're spread out across 6 days.
But that's
And
25,
across days. So some specialists, we open at 7, and their sessions are from 7 to 11. There might be 3 specialists that have 3 different sessions in one day, and they're not overlapping.
Well, it sounds like a little thing
So-
for 50,000 square feet.
What's the name
Yes.
of your dog and your pony?
Oh.
So there's they're, spread across 7 days, and a variety of hours.
So what if you don't get a plan for the parking?
Right.
What happens then?
Well,
So
then,
we get signs on our street that says no Cook County building parking?
well, again, part of this is also, remember, obviously it's your neighborhood and you're here, but we also have to think from the perspective of the patients too. So it's not, if the patients can't get in and get to be seen, that's not going to work for them either. So tonight we can't give you the specifics, but we definitely will have parking, and we'll make certain that it's the right parking for our patients as well as for the community to not basically, and even for the other providers within the other medical providers within the community. If it doesn't work for any, if it doesn't work for one of those, it's not going to work really for any of us. We don't want to cause problems for you, and we don't want our patients to experience problems also kind of get to us. So we need to basically look at, and we also, I have to say, we look at this, and you're saying parking, because I know that's what you're concerned with, and I understand totally why. But we're looking at this as also transportation. So when we're looking at how we do have to factor in what public transportation, we do have to factor in the fact that we transport so many of our patients coming in. And we will look at how we can provide parking for our staff and our employees so that because those that are there all day, they're not coming in and out. So they could be in another location, and we can act, and we do this today. We do this even at our main site. We have a shuttle service where we take staff. Actually, some of the patients have found the lots to be convenient too, where we take our staff, and so that basically, and it works. And both the patients get there on time and the staff gets to work on time.
And I'll say also that the city, of course, does have the ability to regulate parking on the streets. And I walked down this morning to kind of take another look at the situation, and it just little things like, I believe Western Avenue is restricted to 2-hour parking, but there are very few signs because I think they've disappeared over the years. So a simple thing that we can do is make sure that is posted properly and enforced, because that'll help with the rotation. And, maybe on your street, we may want to look at some kind of restriction, depending on how this all shakes out, we don't really know yet.
Sure.
Yeah,
But that affects our family too.
We'll
That isn't
figure that
the-
out, yeah.
yeah, but no, I get what you're saying, for sure.
Is that, I think there's a hand back there. No, it's you, sir. I'm
Oh, me?
sorry.
I got one more for you.
No,
If you- sorry, oh, sorry, go ahead. So
I didn't
we're-
know if you were talking to me.
Yeah, I was, I'm sorry,
I'm
sir.
gonna stand up so I can see everybody. First of all, my name is Ron Bloom. I live on Vermont Street, which is right around the corner from where the Masonic Temple facility is going to be. And, first I want to say thank you. I want to say thank you to Bill, thank you to Tom for organizing this meeting. Thank you to Ileana. Thank you to Deborah for hosting this. Thank you to Commissioner Miller for attending. As I think about this, and I've been in town for 30 years, right? Some of you have been here much longer, maybe some are new to town. This is the biggest single project that I have ever seen in our community in those 30 years, absent the St. Francis improvements that became Metro South Hospital. And, and from that perspective, it's exciting. I mean, we've got a town of vacant storefronts, unkept properties, and, things that make people drive through Blue Island and not even spend any time. So I think from the perspective of something new and something exciting coming in town, and the size of the project, there are going to be some unanswered questions. But I think what I heard here, specifically to parking, and I share those concerns, there are alternatives, and maybe the shuttle service. I was down at Northwestern Hospital today with my nephew, for some medical treatments, and it's complexes like that that have shuttle services, right? They have discounted parking at garages. I mean, the important thing is that there is an acknowledgement of the issue and a willingness to work together to get it fixed. And after this opens, to periodically sit down and say, how are we doing? What other things do we need to be doing to do it better? So, so from that perspective, I thank you for being here, because I was the one early on that was concerned that, we all heard about this project coming, but nobody knew anything about it, right? There was a rushed city council meeting to talk about a parking lot, a public parking lot, to close the deal, right? That's, understandable to an extent. And so I'm glad that a project of this magnitude is finally getting the attention that it deserves and input from the community in terms of the various aspects that it could, that it will represent to our community. Success begets success. So, I would expect that as this opens, we will see other businesses open perhaps, right? And so I think we need to think about all of those kinds of things. But with every project comes impacts to the community, right? We've talked about parking. What services will be provided? Thank you for that list. That's the first time that I've seen that.
That information is also on your flyer.
Excellent, yeah, thank you for that. What will be the impacts to the surrounding businesses? Parking has been talked about a lot, but, and that was an excellent letter. What about people trying to get to those businesses? That needs to be looked at. Who will be coming into our community and from where? Right? We need to look at things like, do we need to be worried about things like increased crime? Do we need to be worried about things like our property values going down? Hopefully they'll go up. But there's other factors that impact every community, and we're interested in all of the above. One of the things that I'm specifically interested in is in Cook County Hospital, Stroger Hospital, is one of the largest, if not the largest, providers of abortion services in the state. And will this facility provide abortions or abortive-related services? And those services disproportionately impact communities of color. And it's important that we understand that. And addiction is real in our society, right? But it's also important to know, will there be treatment centers for methadone? Will there be medical marijuana facilities that people will be coming to? It's important that we understand that. Exciting about the physical training aspect and the rehab You know, we have my 87-year-old mother that lives at home, and she gets physical therapy and occupational therapy. You know, would there be consideration for the facility outside of that perhaps, or maybe some additional room, you know, for the community to use some of the exercise facilities that could benefit the community? So anyway, these are just some of the aspects, and more to come, but I appreciate you coming out to talk about this and understanding and listening to our concerns. And we'll look forward to further developments as this moves forward.
I think there's a hand back here, and then there's...
Hi, my name is Jennifer Casey, and I work for South Suburban Council on Alcoholism and Substance Abuse. And I also do Cook County Drug Court, and I've been a lifetime resident of Oak Forest. So, in my opinion, I do not feel that the population coming into Blue Island is going to affect crime rate. It hasn't in Oak Forest, and we don't have public transportation. So, I mean, people are waiting on the corner a long time for the bus. So, I'm pretty safe in saying that that's probably not going to be a factor for Blue Island. Secondly, since I do Cook County Drug Court and I work for South Suburban Council, a lot of our patients access Cook County Health and Hospital System. We're a preferred county care provider for substance abuse, mental health, and I think this is going to bring great things to your community. I get the parking. You did say that there is a piece of land across the street. Maybe down the road you can build a little high, you know, kind of like how Stroger has the outside parking. I mean, it can be done. These services, I think, for the community are excellent. I actually have a foster son who is in the system. And he will actually be seeing you in a week and a half, so for the first time. So he will be accessing. So although I live in Oak Forest and they're moving to Blue Island, he's still going to be able to access the services here. And this is a really good thing for these people. They're not bad people. They all are good people. Some of them just have different issues, but everybody does have their own. So. I just wanted to say that we've worked with Cook County Health and Hospital Systems. I bring a lot of my patients to Stroger to get their meds, Oak Forest. I mean, I've been everywhere. So it's going to be a really good thing for the community.
Hello, my name is Shantaviki. I'm with CETA, and CETA is a Community Economic Development Association of Cook County. We provide services to low-income families and individuals in the county. And we're excited about the move to Blue Island. We think the list of services you're about to provide this community is going to be amazing. And the opportunities for our customers and individuals and families to access these services. We are aware that there could be difficulty with parking, but I really think when you think about the opportunities to have these specialists in your own backyard is amazing. Really look at the opportunities we're going to have to be able to access this. And county has done an amazing job of just accessing, providing servicing for low-income, working families, individuals. I think the perspective of county needs to be changed, that it's not just for low-income people. It really is. If I can go there with my insurance tomorrow, if that was, you know, that's where I wanted to go, because based on their specialists, they are, I have to say, one of the best, because they've seen everything. And they do their best to try to address the needs of the community. So I really want everyone to see this as an opportunity to have so many specialists in our backyard and have so many amazing resources that we could access. We understand the frustration that people may have about some adjustments, but I do think county always look big picture. They do always look at how to make sure they address the needs of the community. We've worked with Cook County for numerous years with the families and individuals we work with, and we understand that they assist people who are having difficult times, but they assist working families, low-income families, and the fact that they're going to have hours on Saturday really is so that we can access it, because really you have to take off work to go see a doctor, and all of us don't sometimes. We use our vacation time to enjoy ourselves for that doctor's appointment. So this just gives an opportunity to see specialists on our free time. So we are excited about the opportunity. We cannot wait to partner with you guys, and we look forward to the opportunity to send our customers and families to Blue Island.
Thank you so much, really appreciate that. And also just, again, this stating that we do, and we're open to, to everyone, but we definitely see, on every day, we see all kinds of insurances coming through all of our centers, and we will continue that. So, obviously, we have Medicaid managed care, we have the other MCOs, we have our own Blue Cross Blue Shield HMO that we actually created about a couple of years ago. We also see a lot of Medicare patients as well. And again, what we're trying to do is make it more convenient for all those patients to get care closer to their homes, so that they don't have to make all these trips into different places and so forth. Just that's our intent. And so it's really, the services we provide are really the services provided in a physician's office. And we just happen to have a little few more specialties that we're going to have. That's what we're doing.
A couple of thoughts based on what you're saying here and some things I'm learning tonight. One is I do agree that we are, part of the concern about the loss of the hospital is that we're already medically underserved community. So this could be a real lifeline for us, there's no question about it. When I see the range of services that you're providing, it's great to see. My primary care physician is over in, now at the Page Medical Center next to the hospital, and I'm concerned about that. Also, the pharmacy I use is a High Street pharmacy, which is located right there. Great place, wonderful. You don't go to High Street, you're missing something. I'm concerned about what's going to happen to that pharmacy with what's coming up. I see you have a pharmacy, so that's great. I got to say, I'm a little concerned about what's going to happen to my High Street pharmacy and all this. And I don't know whether you're in touch with them at all, but I'd like to consider.
But there's the pharmacy that we have inside of our building. There are certain rules about our pharmacy because of how we get the medications, how we pay for them. Remember, there are patients in our system, this is not just here, it's across Cook County, who, for whatever reason, they're unsure, they don't have the ability to pay. And so for places like ours across the country, there's a certain program to get medications. But there's some rules. The rules basically say that if you have to have a relationship with one of the medical providers in that center. Okay, now we also have a whole other mail order pharmacy that we use for our patients also, that we're relocating that away from OPARs also, but this is not that kind of retail pharmacy. If you do get care, any physician in our building, you can get your medications there. You're able to do that. But it's not the kind that, it's a whole nother license to have it for folks just to walk off the street. So, now we might have some individuals who have an insurance plan that for whatever, they're not able to get their medications with us, then they have the ability to go to those other pharmacies, from the outside pharmacy as well. So I don't know, again, some of the patients who go in there might decide to come to us, and yeah, we do have it's a reasonable, cost sharing arrangement if you have to pay anything out of pocket, but we're not setting up I'll just use not to pick on them, but I'll just use the kind of the retailer, not the CVS Walgreens kind of entity. That's not what we're doing. We're just trying to make certain that certain medications for some of our patients, they literally have when they walk out the door because of what they have.
If a patient is seeing one of your doctors and they need hospitalization, would they then be sent to Cook County Hospital, or would there be other options? We have our two hospitals. We have Georgia Hospital in Providence, but we also have other hospitals that are in our network, if you will. But there's a lot of those patients where I live with county care patients and so forth. There are some patients, I won't, again, because of their insurance status, yes, they would go to Stroman, or Providence. But others, if they're close, if they're in network, their network hospital, they would actually go to that hospital.
I forgot to mention one thing, and Bill and Tom will appreciate this. And this is really more about the building, right? The building mechanics and impacts. We have a very large partner in our community that has got, for lack of a better term, an oil derrick on top of their roof that they use for air conditioning, that aside from looking hideous, makes all kinds of noise. I notice on the Masonic Temple building, there's a huge aluminum thing up there. I don't know if it's elevator related or air conditioning related, but has there been any consideration for noise factors that might be emanating from that unit?
I would have to call on Eric or whatever and so forth. This is kind of a facilities technical.
No, there haven't. That is a brand new 60-ton RTU. There haven't been any considerations for noise. Having done this elsewhere in the Chicagoland area, there have been lots of concerns, exact same concern, that when these units start up, there will be a lot of noise. Never once has any of those panned out, and typically those are on lower levels. This is up on the roof, on top of the 4th story above grade. So I would be very surprised if there is any sort of noise complaints emanating from that unit.
And again, I think, and I'm sure you probably will, we'll do this periodically after the facility opens, to sit down and maybe have a similar meeting, or let's just, see how it's going, right? And hopefully build on success.
I don't think you can expect a project of this magnitude to have no impacts.
Right.
And I agree that you definitely want to keep up, and obviously the parking is the hot issue. And certainly Tom and I are going to be paying a lot of attention to that one. So.
Yes, sir.
The projected cost for this project is $13.5 million.
Around, it's like we had to make a few adjustments, and the number's gone up a little bit. It's gone up.
And then
that adjustment was like the fact that we had to get 2 elevators because we thought that would be better for, for transit through the floors and so forth. So I know it's north of 14 now. So
then, is this project fully funded by Cook County taxpayers?
No, the way this works is that we get, when we have to borrow money, we get authorization. We, Cook County Health, the health system, get authorization from Cook County to actually, and they go out and get the bonds for us. However, in our budget, all of Cook County Health, well beyond everything, including Blue Island and Oak Forest and all of that, out of that budget, which right now we're pegging at for fiscal year 2020, that's about a $2.8 billion budget. Now, more than half of that is because we have our own Medicaid managed care company. And so we're just like any other insurer. We have to pay, there was a question about going to other hospitals. If someone goes to the hospitals in our network, we take some of that money and pay them. But out of $2.8 billion, taxpayer money we get is about, it is $100 million. And that is down. 7, 8, 9 years ago, it was north of $500 million was coming just to the health center to take care of patients. Well, we've been able to, because we've been able to get insured patients in, and it is as a result of the Affordable Care Act and so forth, Medicaid, we have more patients that have Medicaid, but those are dollars, and most of those dollars come through the state, but they come from the federal government. So we actually have insured patients who help us not only not have to get more taxpayer money, but also help us pay the cost of the uninsured who can't, for a variety of reasons, actually get insurance. So what that means, to build this building, we have debt, but the health system must pay that debt just like Northwestern does, University of Chicago does, and all those places. We have to do it over time by the money we bring in from taking care of patients.
But if you're expanding your health center services all over the place, are our taxes going to be raised?
No.
To,
no.
Fund these new facilities?
We've actually reduced the tax. I forget the number of billions we've actually been able to allow Cook County to use elsewhere, because we actually are, as I said, just like other hospitals, we pay for this with the money we get from patients who have insurance.
And it's a money-saving thing too with Oak Forest Health Center, right?
Right.
Because that's so costly to operate.
Very costly. Yes. Yeah, that's well over even like $10 million just to keep the lights on. Yes.
One more question. The Cook County Hospital performs abortions. Will they be performing abortions
No.
at this
We're
facility?
No.
Okay.
And we also not doing medical marijuana either, just. This is a license, we're not doing that as well. So, no.
Well, have we exhausted the questions? Well, I want to thank you too, and everyone from the county and three corners who come out to make this presentation tonight. It's been very helpful to me. I've learned a lot. I hope you all have too. We haven't answered all the questions for sure, but we'll be working on that. So we can thank them for.